Treadmill exercise test is often taken as a fitness test during routine medical checkup. But this is not a test meant for everyone coming for a health checkup. A preliminary assessment of the fitness of an individual to undergo a treadmill test or TMT is desirable. This will include a short check on whether the person has any medical conditions which could increase the risk of the test. Moreover, it is difficult for persons with physical disabilities to undergo the test. Anyone who has had a recent episode of chest pain, dizziness or breathlessness needs a full evaluation of the function of the heart prior to the test. If there is no such instance and one has a reasonable effort tolerance in the form of ability to climb 2 flights of stairs at a stretch during routine activities, it is reasonable to undergo a treadmill test without full evaluation of heart function. Older persons seeking to start an exercise program for fitness needs to undergo TMT in the hospital prior to initiation of such programs, as some of them may have silent heart disease. An initial recording of the electrocardiogram or ECG is done by the technician before the TMT. If an old ECG is available, the current one is compared with the old one for any fresh changes. If fresh changes are detected, the test is deferred and further testing sought. Initial blood pressure, heart rate, height and weight are recorded prior to the test. If there is an extreme of heart rate or blood pressure, again a medical evaluation is sought. Anyone with a current illness like fever is not taken up for treadmill test. Those with disabilities of lower limb naturally find it difficult to do a treadmill. Upper limb disability, though it may cause some discomfort in holding balance during treadmill, need not necessitate deferral of the test. The person undergoing treadmill test is advised to report immediately if there is any chest discomfort, giddiness, breathlessness, or any other new symptom. The technician and doctor in the treadmill room continuously monitors the heart rate and ECG changes during treadmill test to ensure safety. Any significant change in the ECG, heart rhythm, or symptoms mandate immediate termination of the test and further observation. Treadmill room is equipped with all emergency care equipment and medications to treat in case of an event. Observation for a short period after the test is also routine to detect any changes in the ECG during recovery period, which is not uncommon. Those developing persistent ECG changes or fresh symptoms may be advised hospital admission and further care. Discussion on treadmill exercise ECG, also known as treadmill test, TMT, and stress ECG. Treadmill exercise ECG is usually done with a computerized treadmill unit which controls the motor speed of the treadmill as well as monitors the ECG. Speed and slope of the treadmill platform increases stage-wise. The person is asked to walk in a relaxed manner after an initial test run at low speed. Any symptom during the test has to be informed to the attending personnel. Chest pain and breathlessness are important symptoms. A red emergency stop button is provided in front of the person. ECG is recorded periodically during the test in addition to documenting any specific events like an abnormal heart rhythm. Test may be stopped if an abnormal heart rhythm occurs or if the ECG changes are quite significant. If the test is done for detection of disease, the individual should be off medications. But if it is for assessment of effort tolerance while on treatment, it may be done on medications. Though various protocols like Norton, RAM protocol are in vogue, the popular one is Bruce protocol. There is also a modified Bruce protocol for those with lower functional capacity. Each protocol differs in speed and slope of the treadmill. Standard Bruce protocol has 7 3-minute stages. In stage 1, the gradient is 10% and it rises 2% per stage. The starting speed is 1.7 miles per hour and increases in increments of 0.8 to 0.9 miles per stage. In modified Bruce protocol, stage 1 has a gradient of 0 and stage 2 a gradient of 5%. Speed is the same in the first three stages of modified Bruce protocol, 1.7 miles per hour. Stage 3 of modified Bruce protocol is equivalent to stage 1 of standard Bruce protocol. Further stages are similar to Bruce protocol, though the number of the stage will be higher by a magnitude of 2. Treadmill exercise ECG series starts with the pre-test ECG and recordings in every stage of exercise and recovery phase. Heart rate increases as the stage advances. In this recording at peak exercise, changes are seen as ST segment depression measured by the machine as minus 3.1 mm. This is taken as a positive test. Magnified view of ECG illustrating the waves in the ECG, P, QRS, T and ST segment in ECG. In the normal ECG pattern shown in the inset, ST segment is at the same level as the baseline of the ECG. Those with a positive test will be considered for X-ray imaging of blood vessels of the heart by a test known as coronary angiography. ECG changes occurring in earlier stages of exercise have more significance. ECG changes occurring in recovery phase are also important. More severe ST segment depression and those persisting longer have higher relevance. Treadmill room is equipped with emergency medications and machines. The person is closely observed during the test and for a variable period after that till ECG changes, if any, have normalized. In the rare case of any major emergency, the person may be hospitalized and monitored in an intensive care unit. A regular exercise program is highly essential for general as well as cardiovascular fitness. It is useful for any individual who is capable of exercise. For a person with heart disease, the exercise program has to be planned in consultation with the treating doctor. Ideally, if you are planning to start a strenuous exercise program after the age of 40 years, it will be better to exclude cardiac illness by medical evaluation and a treadmill stress electrocardiogram. Even though blood pressure and heart rate increase during exercise, a regular exercise program brings down the blood pressure, blood sugar and cholesterol levels if they are mildly elevated. Severe elevations require additional medical treatment. Regular exercise brings down the body weight and reduces the risk of heart disease. Basically, there are two types of treadmills for home exercise. The simplest is a mechanical one which does not require any electrical connection. The treadmill belt moves with the effort of the runner so that a motor is not needed. The speed is variable depending on the effort put in by the runner. It does not have many controls and is much cheaper than a motorized treadmill. Naturally, the effort needed to run a purely mechanical one is more for any given speed. One potential disadvantage is the higher strain to the lower limb joints. The motorized treadmill is very convenient if you can afford one. Various sophisticated controls are available depending on the cost you are ready to pay. The speed can be varied continuously and so can the gradient or slope. Sensors for checking the pulse rate are available. The exercise time, speed, distance run and calories spent are all displayed in front of you. A word of caution about the calories displayed. The calories spent will depend on your weight being higher for a heavier person, but most machines do not check your weight and only the calories spent for an average person at that particular speed and incline are displayed as a function of the time run. Taking away the boredom of treadmill exercise. If you walk or run outdoors for your daily exercise, each day you can take a separate route and can watch the activities around and enjoy the fresh breeze. You lose out on all these in a home treadmill exercise. After the initial enthusiasm wears off, treadmill exercise can turn out to be a real bore. So how to get away with it? Some finish their morning newspaper reading during the treadmill time. But this is not easy unless you provide a good stand for reading the paper and have some mechanism of turning the pages. Reading small print would not be ideal thing to do while moving on a treadmill in view of the eye strain it is likely to produce. A much simpler way is to watch music or an interesting program on television. Some use just a smartphone to listen to music. For cardiovascular fitness, at least 30 to 40 minutes of exercise for 5 days a week are required. Average calories spent per week should not be less than 1000 kilocalories. For a beginner, start low and gradually increase timing and speed over a few weeks till you reach the maintenance phase. This will help to tune up your body. Every day, the program should consist of an initial warming up and a final cooling down phase of slow speed. Any exercise program has to be maintained lifelong to remain effective. Hence, choose the maximum speed judiciously. Don't try to overdo it. You won't be able to maintain it. Don't forget to use a good sports shoe or else skin of your sole will be damaged soon and come out as blisters. Aquatic or underwater treadmill for exercise in the elderly and for rehabilitation after stroke and traumatic brain injury. Aquatic or underwater treadmill exercise is gaining popularity as a means of exercise training in persons with osteoarthritis who cannot exercise on a land treadmill. Water jets opposite to the direction of walking can be used to achieve high rate of perceived exertion in aquatic treadmill. Water currents in the direction of walking can also support higher speeds if needed for a morale boost in those with lower exercise capacity. The advantage of underwater treadmill is that there is no joint impact due to the body weight as occurs with land treadmill. Both motorized and non-motorized versions of aquatic treadmills are available as in case of land treadmills. The non-motorized versions are obviously cheaper because there is no need for costly underwater durable motors. Aquatic treadmills can be portable or custom made and fixed in a pool. Aquatic treadmill is very useful for senior citizens to avoid the risk of falls and musculoskeletal stress of land treadmill exercise. Regular exercise can improve lean body mass and overall physical fitness in the elderly. It is also useful for obese individuals and those with issues of mobility. Underwater treadmill is useful in those recovering from stroke as they often have poor balance or cannot support their weight. Unlike in land treadmill, aquatic treadmill can have advantages due to characteristics of water like temperature, viscosity and hydrostatic pressure. Cardiovascular changes occurring during immersions have also to be considered. There is redistribution of blood volume from the lower limbs to the thoracic cavity, but the increases in blood pressure, heart rate and rate pressure product are lower with underwater treadmill walking as compared to walking on land treadmill. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video.